Just making sure my audio works. Can anybody hear me?
I can hear you.
Yes.
Okay.
We can hear
It's a new
you.
computer. Just making sure it's a new computer.
Okay.
Oh, no problem, Sam.
Good afternoon, everyone. We'll be starting here shortly. We're waiting for a couple of other panelists to log on. This is Richard Stride, and we will be starting here in a few minutes. Thank you.
Hi, this is Mindy Greenwood. If you get a request to promote, please click that so we can make sure all of our panelists and presenters get up going. Thank you.
You.
Dr. Stride, your microphone is working. We're having some
Okay.
technical difficulties with the camera.
Okay,
If you wanted to go ahead, we'll keep working in the background.
perfect. That sounds great. Well, good afternoon, everyone. My name is Richard Stride. I'm the CEO for Cascade Community Healthcare. I want to welcome you to our 8th annual Legislative and Governmental Forum. It's hard to believe we've been doing this for 8 years, but here we are. I want to welcome our participants via Facebook and YouTube Live and our distinguished panel members. We have with us today Representative Peter Urbano from the 20th District, Senator Jeff Wilson from the 19th District, Senator John Braun from the 20th District, Representative Ed Orcott from the 20th District, Chief Stacy Denham from Centralia PD, Sheriff Rob Snobbat from Lewis County Sheriff's Department, and Commissioner Lindsay Pollock. Dr. Pollock is our Commissioner in District 2, Lewis County. We'll give our panel members each 2 minutes to give us a brief update on what's on their radar for the upcoming legislative session or this next calendar year. We'll then begin with our presenter in order. Our presenters will, if you'll state your name and what organization you represent, you'll each have 5 minutes to present and 2 minutes for questions from our panel members. The intent of our forum is to inform our legislators and local government officials about your work and the need for their continued support. The forum strives to give voice to local social service agencies and how supporting proposed legislation may benefit families in our own Lewis County. I will not be introducing each presenter. You have the order of presenters in front of you, so you'll be able to just log on, and Brad, who is our IT person, will help you do that, and Mindy Greenwood. So I ask that you begin your presentation after the previous presenter ends. This event is on Zoom, Facebook Live, YouTube Live. If we have public comments or questions, we will post those on our 2 Facebook pages and on Cascade's website. Please keep your questions pertinent to our social service issues. And without further ado, we will go ahead and get one of our panel members to kind of give us what's on their radar. We'll start with Representative Peter Urbano.
Thank you, Dr. Stride. I hope everyone's doing well. I didn't know I would be the first person, so I guess well, I think there were some pretty significant investments in behavioral health in this last legislative session, especially if you're looking at from a point of view of capital budget, which I'm assistant ranking on the capital budget committee. There was $200 million investment in University of Washington in terms of behavioral health teaching and a behavioral health hospital. There was $95 million investment in local behavioral health capacity grants. I think there's a recognition that behavioral health is going to be and has been historically underfunded. And there hasn't been enough attention paid to behavioral health issues. You know, Dr. Stride, this is the 8th annual forum, and I think I've been a panelist or a part of this for 7 of those 8 years. And it seems like this group is doing amazing things at the local level. And I'm hoping that at the state level, we're going to see more and more of a partnership where we can get the necessary tools for you all to do the job you need. There were also a number of attention given to schools and school districts in terms of how we can address issues that we're seeing from, whether it be mask mandates or COVID issues or lockdowns or shutdowns, and at-home learning has really impacted students to a level that I don't think we've ever seen before. And I don't think we yet know or appreciate the long-term impacts of some of the things that have been going on at the state and federal level in terms of addressing the pandemic. So, I mean, I'm really looking forward to hearing what our local agencies and individuals are doing to really move the ball forward, and how I can and my colleagues can be a partner in helping. I know that goes for also the issues that many of my colleagues on this call have really had an issue with, which is the issue of alcohol abuse, drug use, and the impact on our communities, whether it be talking about our youth, to homelessness, to how it's impacting education and other services that I know we're dealing with. It's a time where I don't think we're recognizing necessarily new issues, but the pandemic and the response to the pandemic most certainly have magnified the issues that we've been talking about on this call and at this annual conference for the last 8 years. So just looking forward to hearing from all of you on what's going on at the local level, and most certainly that the door is open, it's always open to create stronger partnerships, and how we can at the state level better support you and address the issues in a way that represents our values locally here in Lewis County. So thank you, Dr. Stride, and thank you to all the presenters.
Thank you, Representative Arbano. Really appreciate you being on the call today. Senator John Braun, I see that you are on. Would you like to kind of tell us what's on your radar this year and what you're going to be looking at this next legislative session?
I'd be happy to. Thanks for having me, and I apologize in advance. I can't stay for the whole event. I have a conflict, but I'm able to be here for the beginning. And a lot of this is going to be a little. I'll try not to repeat what Peter already said. Mental health is something we've been working on really on a bipartisan basis for a number of years. And every year we show up at Olympia and say it's underfunded, and we've added nearly every year, certainly every biennium in the last 4 bienniums, record amounts of new funding in mental health. And I'm not saying we're there yet, but we are certainly a lot closer than we were when I got into this topic 8 or 9 years ago. And at this point, money is still an issue, but it's more than just money. And we have a lot of things that have changed, certainly in the last 2 years. I think broadly, we have a pretty good, not perfect, but pretty good plan to get our state back on a better path with mental health, but it's going to take several years to get there. You know, I always go back to the time it took from when we funded the clinic there in the capital budget, and to the time it got built and staffed and operational. That was 3 years, and that is not abnormal. That is normal. It just takes a long time to build the type of resources we need around the state. So just the fact that we've funded doesn't mean we can check that off and say it's done. But it is a step in the right direction. Now we have to take that funding and actually execute with it in communities like ours around the state to get it done. A couple things I would say, just to highlight. One, workforce issues. I think we're going to have a great outcome eventually with bringing the Northwest Hospital online. The investment there is going to be good, both from a provision of care in the state, but more importantly, in my mind, building a workforce. But again, that's going to take a lot of time. And I think the issue now is we don't have the time, that kind of time when it comes to mental health workforce. And we're going to have to think about innovative ways to build that workforce locally around the state. So I would love to hear from folks today or separately what your ideas about what we can do in the middle time where we're waiting to get this the university's plan up to speed, and what we can do with local clinics around the state, how we can help attract people, keep people, get people trained, and not wait, because I don't think we can wait any longer on that. The other issue I thought I would mention, I was on an interesting call with Governor Gregoire a few days ago. She works with an organization called Challenge Seattle, and it's basically a lot of the larger companies in our state that are funding some work to get after homelessness. And the connection, as you know, between homelessness and mental health and substance abuse issues is huge. And they're doing, I think, a very good job of looking at the data. And the data says we have a long way to go. And then not surprising, they're focused a lot on the Central Puget Sound, but really also looking at the whole state. And we have, and recognizing we have this challenge all over the state. And then who can we learn from? And they've identified a couple folks, not folks, but cities around the country. The one that comes to mind is San Diego. Sticks in my mind because I was there not that long ago to visit a couple of my children, and it's stunning the difference between going there and going to Seattle or Portland right now, or even to Olympia right now. They are doing something right. And they haven't always been that way. They had a similar trouble a few years ago. They're doing something right. We have to go figure out what they're doing right. And I think we can learn from them. And I think that will help us both with, it's going to help us with homelessness, of course, but also as we deal with it, with mental health, substance abuse. And one of the things that we can learn, I think, immediately, although I'm not sure yet how we act on this at the state level, is this idea of getting folks help more immediately. Then again, back into homelessness, you say you identify someone with a problem, some sort of challenge we can help with. We know there's care available, but we get an appointment and then we drop them back off at the curb or at the shelter or wherever. And then the odds of them making it to that appointment a week or 2 weeks go down every day that passes. And we have to find a way to get through that, get them the care they need more immediately and more personalized to get them on a better path and back, to some semblance of normal life in the future. I think that's a diagnostic without an exact plan on how you do it. So I'd love to hear about what we can do to be more responsive more immediately to folks, that if we don't get them the care when we see them today, or that the odds of getting them to that care that they need go down. How do we help that? And I suspect there are many folks that are going to talk today that can talk about that. And then the last thing I would say is this has been top of mind for many people for many years now, but we've all been distracted by the last 2 years, right? COVID has impacted our lives in so many ways, and it's taken our eye off the ball on mental health, on substance abuse, on homelessness, all these things that they are not controversial issues in the sense that, they're not political. And we have bipartisan support to work on all these things. And we don't always agree, but we agree much more than we disagree. And there's a way forward, but we've been distracted, and we got to get our eye back on the ball here and really focus on what we can do. So those are the things I'm thinking about. I'd love to hear what I can in the time I have available, and thanks for the time to speak.
Hi, this is Mindy Greenwood. Sorry, I know we've just gone through 2 of the panel members, but I've been tasked to be the timekeeper, so we got to really keep them to 2 minutes so we can have all the presenters get you all the information that you guys would love to hear from us.
Thank you, Mindy, for being our timekeeper. Thank you, Senator Braun. I really appreciate all your words. Thank you so much. Representative Orcutt.
Thank you, Dr. Stride. Thank you, Dr. Stride. Thanks for hosting this again. I think I've probably been at all of these as well. Senator Braun and Representative Abarno really pointed out a lot of different aspects of things that we need to be looking at and working on. It's kind of hard sometimes to go last, but fortunately the other 2 did leave me one topic that I could talk about, and that's the effect that law enforcement reforms have had on behavioral health. And Dr. Stride, I know you have emailed us regarding this. I've also had emails from some constituents, individuals who had a family member in crisis that have talked about the damage that has been done as a result of these laws and law enforcement not being able to respond. And it's something that I talked about when they were even looking at some of these reforms, is that we need to make sure that law enforcement can go in, stabilize the situation, stabilize the individual, and then allow the teams to come in, so that you've provided for the safety for the crisis intervention team. You provided safety for the individual who is in crisis, and you provided safety for the friends and loved ones of the individual in crisis. And that's some very key points. So I think that's something that we need to work on. But I want to make sure that I get this one point across regarding what has to happen after 5 o'clock today. When this forum is over with and everybody has given their presentations, it shouldn't end there. All of the presenters should be watching what's going on in the legislature and letting us know when these proposals come out for changes, what's good about that change, what's bad about that change, what hasn't been included in that change, and continue to communicate with us throughout the legislative process to make sure that we get these all of these fixes right, whether it be on the law enforcement or whether it be on homelessness or just behavioral health in general. So we really look forward to today, to hearing all the presenters, but also continuing to work with you throughout the legislative session to make sure that we get policies that work, not only for those who are providing the services, but for those especially who are needing the services.
So that was right at 2 minutes. Thank you.
Thank you, Representative Orcutt. Certainly appreciate you being here today. Senator Jeff Wilson, are you on?
No,
Okay.
we haven't seen him.
Okay, then we'll move on. What about Chief Stacy Denham?
No. Sheriff Snaza and Commissioner Pollock are the last two for the panel.
Okay, Sheriff Snaza, you want to give us an update on kind of what's on your radar this next calendar year?
Well, good afternoon, everybody. And this is my 8th year of being on this forum, and it's been great. We got our staff here. I just want to echo what Representative Orcutt and everybody else has mentioned. Everybody's right on. I think it's going to be a team effort that we need to fight for our community. With the Blake decision, it has really affected us, as well as House Bill 1310. And we're hoping for some corrective action in 1310 so that we can address some of the issues. And I know that our work out in the field has directly affected Dr. Stride and his staff, because there's a partnership there. And I think since the implication of 1310 and the Blake decision has really taken us back a few steps, we need to step forward. And I look forward to listening to everybody as to how we can move forward, what we can do together collaboratively as a community. This is an important issue, not only for Lewis County, but for everybody in the state of Washington. So I look forward to hearing everybody and listening to ways we can fix this. And I just want to thank everybody for being involved, because this is such a great community with passion about addressing the needs. As Senator Braun said, homelessness, mental health, and drug abuse. Those are the three things we talk about all the time, and they go hand in hand. So I look forward to hearing what everybody has to offer. So thank you for letting me be here.
Thank you, Sheriff Snaza. I certainly appreciate your participation. Commissioner Pollock.
Good afternoon, everybody. I appreciate the opportunity to be here. We're hearing a lot of discussion about how to react to problems in our community with substance use disorder and homelessness. One of the things the commissioners are focused on is actually being proactive, and we're utilizing our foundational public health dollars. We've hired Lindsay Schenkel to get out into our schools and begin focusing on behavioral health in our children. The goal here is to prevent the development of substance use disorders and all the issues that come with them. We want to work on being able to give kids healthy coping mechanisms and good mental health strategies to deal with the bumps in life before they turn to self-medication. So we'll be interested in hearing how we can better deploy those services. Thank you.
Thank you, Commissioner Pollock. Certainly appreciate your participation today. So we will begin with our presenters, and Dr. Kevin Concerta, you are up first.
Excellent. Thank you so much. And I don't know if my slides are available, but I don't need to wait for them because I do want to be respectful for everybody's time. So not seeing them at that point, I just want to start by saying thank you to our panelists for your leadership, as well as to our presenters, because what you're doing for your community, your partnership with Providence makes us all healthier. So thank you for that. I just want to stage set a little bit about Providence Centralia Hospital in general, so that way you can kind of understand the scope and the challenges we have with behavioral health, but you have to understand the whole Providence Centralia. So Providence Centralia, on average, we see about 75 patients who are actually in the hospital at a time. And, of those, generally about a 1 out of 7 actually don't need to be in the hospital. We see about 35,000 emergency departments each year. And unfortunately, 1,300 of those people are struggling with behavioral health challenges. And with that, we're really thank you so much. We'll go ahead and skip to maybe slide number 3, please. Oh, perfect. So as I mentioned, we have about 1,300 ED visits and just in every year with people suffering behavioral health challenges. And that has been a growing problem for Providence Centralia Hospital, as well as our whole community. And part of that is it's very hard to find a safe, appropriate place to discharge that person from the emergency department. And so on average, each of those people stay about 2 days. And then an emergency department that's a little over 20 beds, if you could think about it, you have about 7 people maybe at a time who have behavioral health challenges. And we do everything we can to provide a safe, healing environment for them, but they're not in the definitive place that they need. And in particular, some of our panelists mentioned pediatrics. That population, unfortunately, with the COVID epidemic, we've definitely seen an increase in the number of our kids, our community's kids coming to our ED with challenges, hurting themselves, suicidal ideation, those sorts of things. And unfortunately, our state is really underbedded, meaning we do not have enough psychiatric beds for that very, very vulnerable population. And sometimes it takes a week or even 2 weeks to find the appropriate place, to put this child in where he or she can get really the definitive treatment that they need during this time of crisis. Another vulnerable population that we see are those people with dementia, and it very much is a challenge to discharge them if they have dementia, and in particular, any behavioral concerns associated with it. Try to find an adult family home or skilled facility that's willing to take those people, and they often stay in our hospital sometimes for months waiting for placement. Unfortunately, violent behavior has been an increasing problem, not just in Providence Centralia, but across healthcare. And unfortunately, it's nearly on a daily basis that between Providence Centralia Hospital and Providence St. Peter Hospital, one of our caregivers is assaulted. And in fact, a few weeks back, we had a caregiver who was just working at one of our nurses' stations, back was turned, and a patient just snuck up, fled from the room, snuck up behind, and just punched our caregiver. And we've had worse events than that. Associated, and these are partners that are working really hard anytime that we get a patient who may need a medical clearance before going to jail, because those patients tend to be very violent, or a person who needs a designated crisis responder. There's just not simply enough in the community, and they're working hard. So these are great partners, but they can't always place patients. And we had people who eventually they have to give up. We've had an elderly person with psychosis, and they've been with us, I think now 60 days plus, because there's no appropriate place for that person. And then also what occurs is once somebody's in the hospital, if they have any associated behavioral health challenges, they tend to stay long time in our hospital. And if you think about the COVID epidemic, where we average 70 patients, about 1 out of 10 of them are in the hospital who don't need to be there. And that puts a big strain on our caregivers and our healthcare system in general. Next slide. And so we want to continue to partner with our community. Yeah,
Start
please.
your 5 minutes. Your
Okay.
5 minutes are up, sorry.
Perfect. So we're adding telepsych. We're behavioral health specialists, and we're actually building a psychiatric hospital in Lacey that we hope to break ground in first quarter of 2022 to include adolescents and geriatrics to hopefully solve that problem. I'm happy to entertain any questions. Thank you.
And the panel has 2 minutes now to ask questions.
It looks like you answered everything, Dr. Caserta.
Well, thank you all for your partnerships.
Thank you so much. And remember, presenters, we're just going to go through the list. I'll call on you if you don't come up, but if not, we'll just go ahead and go through the list, and Mindy's up next.
Hi, so I'm Mindy Greenwood. I'm the SUD director here at Cascade Community Healthcare, and I'm excited to present again. I've been doing it all but the first year. So, and as you all know, my passion is in SUD, so I'm going to be talking about that. I'm not going to be asking for money, but I just want to talk about some of the things that we've gone through pretty much since 2016 and all the changes, and then also how the pandemic has hit us. The first ask is, I do know, as Senator Braun was saying, there's a lot of things coming through the legislature about SUD, changing how we deliver services, those kind of things. I would ask that we be very thoughtful on that. There's a lot of things that are trying to be changed, and we're just trying to get our bearings coming out of the pandemic from the last 2 years. We had to very quickly on a dime change how we do services, and so we're trying to get back up to normal. That being said, we are all for any kind of legislative changes that will help law enforcement help us out more to get people into services, especially with the Blake decision. That has been a huge effect for us. Unfortunately, legal is the major way that people get into services for SUD. I know that that's a hard pill to swallow, but sometimes, most of the time, that is the only way that they get in. For Senator Orcutt, last year you had asked me about what Oregon had done with decriminalizing, and they just put out an article in June. What they found with that is they made that leap very quickly, and a lot of people are not accessing systems, and because for a couple of reasons. One, they're just getting a $100 fine, and it's equated to a parking ticket. And when you're in your addictive thinking and your distorted thinking, that's not going to be enough to encourage you to get into treatment. The second thing is that the system was not prepared. They did not have everything in place. Primary care is not on board to take this on. They believe that the specialists need to do that. They're there to help support us, but they believe that they are not the place to be taking on SUD. They agree that they could be a frontline and make referrals. So systematically, Oregon was not prepared to do what they did, and it has been a huge hindrance to the community for those that are using and for the community members at large for the behaviors that go along with it. The second thing that I would like to look at is there's a lot of talk around peer supports, which I full-heartedly agree with. SUD counselors are like the godfathers of peer support. The issue that we have with that is a lot of the grants that are coming down to put peer supports into place are dictating a wage. In a lot of cases, that wage is higher than we're able to pay our professionals, which is interesting. So as we know in this day and age, everybody tells everybody what their wage is, and it creates a problem, and people start job hunting and going away and creates problem which then in turn creates a workforce issue. So I would like us to continue to look at the discrepancy in the reimbursement costs for SUD. As I shared last year, there's a 52% discrepancy just between a mental health reimbursement and an SUD reimbursement. I don't even want to talk about the discrepancy between primary care and behavioral health in general, but there is that. So again, I appreciate you guys coming to this, listening to us, hearing about the struggles that we've had in the year and moving forward with that. And that's all that I have. If anybody has any questions.
Looks like there are no questions.
Thank you.
Thank you.
Hi, everyone. My name is Andrea Coletto, and I'm Community Relations Director with Twin Transit. I am really excited that I got to follow Mindy Greenwood because I think, as you'll see, she and Cascade in general have been a really big part of our evolution over the last couple of years. So just to kick it off, I'd say if you're here, you probably believe that, access to mental health and SUD treatment is essential to a successful life. The providers in our community already are doing a really phenomenal job. Our role as Twin Transit is to help people get to them and get to their services because access is everything. Our fixed route and our lift service have been helping people get to those treatments for a long time, but it's not enough. We've been in conversation with Cascade for a few years now, and I still remember the conversation that started it all, which was with Mindy. And she was telling me this story about a patient that they had that was in some court-mandated SUD treatment. And the patient called her one day, just panicked because they were due to be there for treatment and their ride just never showed up. And they tried to scramble and figure out a way, but the patient couldn't get there, which meant that they were in violation, which meant that they went back to jail. And so our conversation was, how do we ensure that this never happens again? How do we help people that are in a situation like this? And it's not just that, it's people that live out in rural communities, both, far away in Morton or Pale, or just a few miles, too far to walk to a fixed route. There's people that just struggle to navigate a transit system or who just don't do well in a large group. So working in partnership with Cascade and some of our other community partners, we started a new program in November of 2020 of last year called DART, which is Dial a Ride Twin Transit. And it's a direct door-to-door transportation program. It's really simple. People just call us up by 4 p.m. the previous day. They say, hey, I'm here, I need to go there. And they schedule their ride and we help them get where they need to go. And it's, if you kind of imagine like a big concentric circle around the Twin Cities, Centralia, Chehalis in the middle, and a circle going out as far east as Morton and as far north as Olympia and Lacey, because that's where so many specialists are. That's kind of our service area. For now, we're really hoping to expand it, get down south a little bit more to Longview and Kelso kind of area. And it's affordable is the other big piece of that. So it's probably $3, I think, each way in the Twin Cities, and then as much as $15 each way if you go up to Olympia. And we're really looking to improve that. This has only been going for a year now, so hopefully we'll be able to make it even more affordable going forward. And I would say that adoption has just really exploded on this program. We knew it was going to be, well used, we hoped, but it got a little bit of a slow start last year. I think we had 20 rides in the entirety in November, but then over the spring, it just kind of rocketed up there. And then in October, we had almost 400 rides. And then November was just shy of 500 rides. And then this month's on track to be even more than that. And we take people all over the place. We take a lot of folks to mental health appointments, SUD appointments, and a lot of other places too. We've got patients that use it to go back and forth to chemo and to other routine medical treatment like that. We've got people who have had an injury, can't drive anymore. They use it to get to work, so they're able to maintain their income. We have elderly people, who use it to go get treatment up in Olympia area. And especially for folks who have kids out of the area, we do get a lot of calls from people who say, hey, my mom or my brother or whoever lives in Centralia or Chehalis or Morton, and I really need to help them get here to this place. and I can't do it because I live in California or I'm out of the area. And so we're able to help those people get their loved ones where they need to go, which has just been really huge. And I think, as Mindy would tell you too, one of our goals for this program was to help increase or decrease the amount of people who didn't show up for their appointments, help provide a direct line of access for them. And then I see I only have 1 minute left. So I just wanted to touch on real quick. We did recently establish a voucher program with Cascade so that they have a way to use grant funding to directly pay for the rides for their patients who need it. And that's available to any community organization that needs to do something similar or is interested in that. So if anyone's interested, let me know. And as you know, our leaders here know, transit's largely funded through consolidated grants and 0.2% of our local sales tax. But something we're really excited about is trying to diversify that moving forward and using things like clean energy technology to provide another income stream. So right now we have our Mellon Street transit station that has electric car charging that provides us another income stream. So as you're looking, you know, in this coming up session at opportunities for funding things like transit, that could be another really great source. And then I think that's my time. Any questions? Sounds good.
Thank you, Andrea. Appreciate your time. We're going to pause here just for a second, and I see Representative Walsh from the 19th has joined us. Welcome. If you want to just give us a couple of minutes, an update, kind of what's on your radar for this next legislative session, we'll just take a couple of minutes to have you update our presenters and those on Facebook Live and YouTube Live.
Sure. Well, sorry I was late, but I was on another Zoom dealing with water mitigation issues. So as Mark Twain once said, whiskey's for drinking and water's for fighting. And we are looking for solutions to our water rights, complex water rights system here in Washington. Well, you know, obviously this is a short session coming up, so it's going to be short. It's going to be quick and fast. Of greatest relevance to Cascade, we're trying to look for good reforms on some of the law enforcement policies, essentially reforms to recent reforms that have constricted how law enforcement agencies can deal with people in crisis and hopefully resolve some unintended consequences that we've seen in recent law passed out of Olympia that will allow both law enforcement agencies and agencies like Cascade that provide various services, including mental health services and behavioral health services to people in need, to get those people the help they need more quickly and more effectively. One of the unintended consequences of some recent reforms was that they basically made complex the process of getting people who are in crisis to places that can help and to people that can help. And I think that some of the reforms to the reforms that we're going to be looking for, and I think we're going to be getting even in this short session, are going to clear that up. And that will make helping people who need help more effective. So that's the biggest issue I'm looking at. There are many issues. I mean, we're going to be probably dealing in some manner with some of the emergency powers issues that the state's been dealing with and living through the last couple of years. And we may look at a couple of the tax issues, including the payroll tax issue around the long-term care
Representative
program.
Walsh.
So that's what'll be on the agenda for the short session.
Perfect. Thank you.
Thank you so much. I really appreciate you being here. So we'll go ahead with our presenter list, and Lewis County Public Health and Social Services, JP Anderson's up next.
Hi, everybody. My name is Lindsay Schenkel. I'm the health educator for Lewis County Public Health and Social Services, focused on youth resiliency, youth mental health, and behavioral health. JP had a last-minute conflict, and so he asked me to speak in his place, and I'd like to update you on what I've been working on and what our next steps will be over the coming months. So one of the major projects I've been working on recently is a community readiness assessment for youth mental health and suicide prevention. I've been using something called the Community Readiness Model, which is a structured interview framework conducted with community members representing an array of sectors and stakeholder groups. The domains addressed in this model are current community efforts, community knowledge of current efforts, leadership, community climate, community knowledge about the issue, and resources related to the issue. So I've conducted 9 interviews in line with the framework with folks who live and work in Lewis County to identify where the community is at with regard to readiness assess youth mental health and wellness. So part of the group that I interviewed includes school personnel, law enforcement, court system workers, city and county government employees, religious leaders, and mental health or treatment service providers. So the results of this assessment will help us identify the community's readiness to address youth mental health challenges and allow us to recommend a series of stage-matched interventions, which will ensure that we meet the community where we're at with regard to readiness, priorities, and values. And so we're now in the process of analyzing these interviews, and that once that's done, I will create a final report that recommends tangible next steps for our community for addressing youth mental health and wellness. Another piece of this project is a virtual youth focus group, which will similarly address youth's perceptions of their priorities and needs with regard to their mental health and well-being, which will be folded into the major report as well. Another thing we're really proud of bringing to the community is something called the Keep Connected curriculum. It's focused on a strength-based train the trainer program that emphasizes parent and caregiver and child communication, strengthens family relationships, and builds a local network of support among community members. The county commissioners approved up to $40,000 of ARPA funds to bring this curriculum to the community. And just a press release went out this afternoon announcing the program. And we're looking forward to scheduling the initial Train the Trainer workshops to bring this to the community next year. Also, with regard to House Bill 1477 for the Crisis Response Improvement Strategy and the rollout of the National 988 Suicide Prevention Line, I am going to be serving on the Rural and Agricultural Community Subcommittee, and I'm excited to bring the voice of our community to that very important work. We're also working with Great Rivers Behavioral Health Administrative Services Organization on a survey to quantify the capacity challenges related to youth mental health services, including average length of wait list, average caseload of staff, et cetera. And we also are really emphasizing our other community partnerships, such as a school work group comprised of some local school superintendents, pediatricians, and the county health officer, as well as our relationship with ESD 113 and other efforts. So thanks very much for the time, and I appreciate participating in this very important conversation.
Hello, my name is Heidi Palmer. I am the Lewis County Veterans Benefit Specialist through Lewis County Public Health and Social Services. So I work with our veterans in our community. So if anyone doesn't know, we have roughly around 7,700 veterans in Lewis County. And I'm sure everyone has heard, especially if you work around veterans or mental health, that in our country, we lose about 22 veterans a day to suicide. So mental health is incredibly important to our veteran community. Mental health is also a challenge for veterans for various reasons. It is not accepted in military culture. It's not talked about. It has a very negative connotation to it, which really needs to change. And which I think can be where peer supports can be really utilized, especially for having providers that understand military culture. And having reliable and consistent providers available will be extremely important to have, and especially those with military culture backgrounds, to make it more comfortable and more inviting for veterans to come in and want to receive those services that they really direly need and are struggling with. Wait times is also a challenge. Especially since, our VA clinic here in Chehalis closed at the end of October. That has caused a lot of challenges and barriers for our veterans, especially for those who are unhoused. Transportation, getting to Olympia can be a challenge. And thankfully, I have a contract through Catholic Community Services where we can provide transportation to our veterans, no matter where they need to go. If they need to go to the Seattle VA, Portland VA, anywhere, we'll take them. And it's free to them. It's actually paid through our program, through the Veterans Relief Fund. And hopefully we can get more private providers or anybody else who's a provider to become certified through the VA as a provider for community care, because then veterans can have other options besides just going to the VA for mental health or even substance use and even physical care. Having those options is great. I really would love to see some support groups, because as veterans, yes, we're all veterans, but we're not the same. There are so many different types of veterans that really need to be supported. I mean, we have our LGBTQ plus community, we have deployed versus non-deployed, and also different eras that are around, and having those support groups with peer supports that are from those eras or communities will be very important, as well as alternative therapies. Behavioral health is not a one size fits all. So I think if we have alternatives for veterans who don't always just want to or feel comfortable sitting in office, I think it would be very beneficial. And outreach teams for our unhoused community that are on the community that aren't comfortable always coming in, and especially those on the East End for us here in Lewis County. Any questions? I know that was quick with a lot.
Doesn't look like there are any questions. Thank you very much.
Thank you.
Well, good afternoon. I'm just pulling up my notes here. I'll try to keep it brief and remain within the timeline. My name is Trinidad Medina. I am the Chief Executive Director of the Great Rivers Behavioral Health Administrative Service Organization. And yes, that is a mouthful. We refer to ourselves as the BHASO. We began operations in January of 2020. Our mission is to provide access to high quality, cost efficient behavioral health services to empower individuals and families in managing their health, safety, and well-being. We are contracted by the state of Washington and Apple Health Plans within the region to provide services for individuals experiencing behavioral health crisis and other state-funded non-Medicaid behavioral health services. Our crisis services are available to all individuals in Lewis County, regardless of their insurance status or income levels. Today, I'd like to share some information about our crisis services specifically, and some of the impacts that we've experienced as of recent times. Our crisis system consists of 3 components. The first level of service is a crisis hotline. We have a regional hotline service that covers our entire region. As needed and requested, the hotline team will dispatch the intervention services team provided by our local mobile crisis outreach team. Cascade Community Healthcare is our mobile crisis outreach team in Lewis County, and we're very grateful for the service that they do. They do a fabulous job. Our third level of service is involuntary treatment evaluation provided by our designated crisis responders, and that is provided by Olympic Health and Recovery Services. They also do a great job, however, have increasing challenges as a result of recent legislation. As an ASO, we're becoming increasingly concerned with the impacts of the COVID pandemic and the bills enacted in the last legislative session, especially House Bill 1310. I think we all have touched on that a little bit. And so I won't go into the impact specifically, but really what it's doing is it's increasing more vulnerable workforce, increasing vulnerabilities to our workforce. Our crisis workers are going out in potentially unsafe situations. And so what that is doing is it's reducing the number of outreaches that are happening in our communities. Fewer people are securely being transported to inpatient facilities when needed. Our DCRs will do an ITA evaluation, determine the individual meets criteria for detainment. However, we can't find secure transport to get the individual to the appropriate level of care. And what we're seeing is, as a result of that, is just more people in the community that need help. Solutions would include revisions to the law, increase in co-responder models, and possibly looking at alternative transportation methods or options. We as an ASO host a regional meeting, and that is one of the tasks that we are looking at is options for secure transport. There are other states that have specific funding for secure transport. And so that may be something that could be a solution to resolve some of the issues that we're experiencing there. To change the tone a little bit, we are supportive of the efforts of House Bill 1477, the act relating to the implementation of the National 988 system. As with Lewis County Health Department, Great Rivers is also on a couple committees. We have a representative on the Rural and Agricultural Subcommittee and also the Technical Subcommittee so that our voice is heard. Our system is currently under evaluation. We've undergone a few surveys that will help inform the work of the CRIS committee, or the Crisis Improvement Strategy Committee, that's been formed as a result of the bill. What we're asking is that we look at implementing the bill utilizing current infrastructure and local resource versus centralizing statewide systems. Sometimes that centralization of statewide system creates just another layer of individuals that have to go through to receive service. A scenario where that effort makes sense is with the bed registry. There is some work being done to implement a bed registry for psychiatric inpatient beds. That makes sense to implement it statewide. And that will be very helpful to our DCRs and local mobile crisis teams when trying to locate beds and helping our clients get to those beds. Funding. We have, yes?
Your time's up.
Oh, my time is up. Okay. All right. Well, I have other items to cover, but thank you very much for your time. Appreciate it. I would ask that we look at some flexibility and looking at our region, Lewis County specifically, as a rural community, and not always the one size fits all will meet the needs of our community. Appreciate your time. Thank you.
Thank you, Trinidad. Important issues.
Afternoon, my name is Samantha Mitchell. I work with the Youth Advocacy Center of Lewis County. I'm the child forensic interviewer and the clinic coordinator over here. I hate reading from a script, but in order to honor the time allotment, I'm gonna kind of reference my notes more than I normally would. We are a satellite clinic of the Monarch Children's Justice and Advocacy Center, which is a nationally accredited child advocacy center. With their guidance and support this year, the Youth Advocacy Center will be able to submit their application for our national accreditation, which is a really big deal for us. If those of you who are not familiar with my agency, I receive referrals from law enforcement to conduct forensic interviews of children where there have been criminal allegations of abuse. That's sexual abuse, physical abuse, neglect, maltreatment, torture, exploitation, trafficking, just to name a few. We provide a child-friendly and trauma-informed settings, and the interviews are done in follow a legally defensive protocol. We partner with every law enforcement agency in Lewis County. We work with the prosecuting attorney's office, child protective services, and support agencies from other jurisdictions as well. We also provide on-site sexual assault medical exams, which are provided by Providence St. Pete's Sexual Assault and Child Maltreatment Center. We work with Hope Alliance and CIELO to provide advocacy services to the families. And most recently, Cascade has helped by providing me with a care coordination support. And that's been amazing to have some support over here, because it is just me running this agency right now with the support of Monarch, who oversees. The Youth Advocacy Center does not duplicate any other service in Lewis County. And we thrive on being able to refer families that come to our center to other service areas, and especially mental health. I've been speaking at this forum for the last couple of years, and every year I share the demographics of the children and families that come through my center. And every year I tell this forum the numbers are going up and the cases are getting worse. The only difference this year is that it's been worse than all of the rest of the years. I've interviewed a total of 129 children, which is a 15% increase from last year. And the month's not over. We have more cases coming in every year. While interviewing those 129 children, we've identified 359 types of abuse, meaning that every child that came through potentially experienced 2 types of abuse, more than 2 types of abuse. There were 185 alleged suspects identified, and all but 3 were known trusted adults or known trusted persons to that child. 37% were between the ages of 3 and 6, 34% between the ages of 7 and 12, and 29% between the ages of 13 and 17. So I'm going to put this to you in another way. 71% of the children that I interviewed for abuse allegations by a known and trusted person in their lives were between the ages of 3 and 11. Yes, 3. And we have younger kids. Last year, 31% of the kids, we've also had a few new trends this year. One of the increases is the disclosure rates among boys. 31% of the children last year that came in were male. This year it's jumped to 43%. We've also seen an increase in the number of children with disabilities and the number of suicidal ideations. And what I mean by that is when the children come in, at some point they've had suicidal thoughts in the process of disclosure, whether that led to the disclosure or other issues. Every year I get thanked for sharing the numbers, and every year I invite the leaders of this community to come to my center and see what we do and hear the stories behind those numbers. And rarely does anyone come. It's more important than ever now for the leaders of this community to acknowledge that we have a crisis going on. And so I'm inviting you again to my agency to come and see what's really happening and what's really going on. You need to hear about what our children are experiencing and what they are telling us is happening to them, because they're not a number. The pain of isolation that our children have faced is already showing trends for long-term consequences, and if we don't start listening to what is happening to them. That's why we're here, the Youth Advocacy Center. It's not just to listen to what happened, but to allow these child to have a safe place to talk about it and hear them and give them a start to path to healing. So again, I'm asking for our community leaders to take an hour out of their day to come and see what we're doing and have a conversation on immediate and inexpensive steps on being proactive and making our community a safer place for these children. One of those steps is by giving every child between the ages of 3 to 17 who have disclosed abuse the opportunity to talk about what happened to them in a safe place, and then be supported in accessing resources to help them on the path to healing. And that place is the Youth Advocacy Center. We are the first step into fixing all of these systemic issues that we have going on that we keep repeating over and over again. Thank you.
I just want to remind panelists that we do entertain questions from you if you have questions for any of our presenters. So please let us know if you do have questions for anyone that's presenting or somebody that presented in the past. We'll certainly be happy to entertain those questions.
Samantha, this is Commissioner Lindsay Pollock. I was wondering if you could touch briefly on your darkness into light training that you've taken out into the community.
Absolutely. It's an evidence-based training. It's about 2 hours, 2.5 hours, and it shows the adults in the community how to react and respond to child abuse. And the statistics show and the evidence shows that if you have 5% of the adults in your community trained in darkness to light, then you'll have a systematic change in how the community responds to the children, and it's a positive change. Since 2018, I've trained 1,799 adults in our community on darkness to light and other topics around child abuse and trauma that our kids are experiencing in Lewis County.
Thank you, Samantha.
Okay, so this is Mindy Greenwood again. Ruth Gutierrez from Housing Resource Center wasn't able to join us today, but she did send in a video. And if you have questions from the video, please go ahead and type it in. We'll write them down, get them to her, and then get them back to you guys, her responses. So we're gonna play the video for you now.
Recovery housing, which is a rental assistance program, which will help with move-in costs.
Looks like we're having a few problems with the sound, so we'll get that taken care of here quickly. Thanks.
One is the McKinney-Vento program, which is for families with children. They pay no greater than 30% of their income towards their rent. And we also have a youth demonstration program, and that is for individuals from 18 years of age to 24. Both of those programs are a 2-year subsidy programs. Participants pay no greater than 30% of their income towards their rent. We also have the Housing and Essential Needs program, which is individuals become eligible through that program from DSHS. They're chronically homeless or at admitted risk of being homeless. I guess I should have started out with that in the beginning. We provide services to chronically homeless and intimate risk of being homelessness. That encompasses all of our programs. The HEN program, we are able to pay part of their rent or the majority of their rent up to $600. We'll also be able to help with the rental, with the utility allowance, a utility assistance, pardon me. And we provide them a gift card to the dollar store so that they can buy their essential needs, like toiletry items and such like that, toilet paper, shampoo, things of that nature. Within all those programs, we are a client-driven service, which means we meet the client where they are. We provide the services as hard as the client will work, that as hard as we're going to work, but actually we work a little harder, really trying to push and drive the programs for those clients. We help them locate housing, maintain housing. We do case management. That case management is going to involve everything in their aspect of their lives. If they don't have a driver's license, birth certificates for all children in their households, moving them forward to whatever barriers that they feel are barriers to their housing. We give them direction towards addressing those barriers, moving towards stability. Again, we meet the client where they're at. When they become housing ready, then we move them from shelter to rapid rehousing, or however that will work for them when they are housing ready, and they determine when they're ready to move forward into housing for themselves. Our shelter is low barrier again, so we don't have any parameters on, we don't deny anyone from that shelter. The only thing that we deny is level 1 sex offenders to our single men and single women. Sex offenders are not, those are not in our family shelter. That's part of what we don't provide services to, unfortunately. All of those programs, we try and meet our community members, our most vulnerable community members, where they are in their service need, and addressing and dealing with their barriers, moving them forward, walking with them in the path, trying to do wraparound services, coordinating with other providers in our community. If we can't provide the service, we'll reach out to someone else who can provide the service. And just making those connections, helping them write letters to address their barriers to their potential landlord, helping them fill out applications for those potential landlords, going with them to meet with their landlords. And we also, once they are housed, we don't drop them. We continue their service. We try and implement and ensure that their stability happens while they're in their housing, and so that they can maintain and move forward within their housing. I appreciate your time. If you have questions, please feel free to reach out to me. Ruth Gutierrez, 360-736-5140. I appreciate your time. Thank you.
Hello, this is Todd Chappett. I'm here representing the United Way and the United Learning Center. I want to thank everybody, Dr. Stride and the panel, for allowing us this time to communicate with our elected officials and update them on what we're working on. The ULC is something that came out of the United Way roughly 4 years ago. Once we established the 30 by 30, that was 30% of people out of poverty by the year 2030. Something that we had spent a lot of time interviewing community leaders and the community itself on trying to find what some of the causes of poverty are in our community. And it settled around, once we could no longer ask the question why, it settled around early education. So the focus of our efforts at the United Way became early education. Through that, we started on this path to the United Learning Center. Initially, it was just going to be a learning center. We've now branched out with partners, and these partners have made us stronger and a more vibrant opportunity for downtown Centralia. Current partners consist of the Discovered Children's Museum. We've got the Boys and Girls Club of Lewis County, the City of Centralia, and our newest partner, which I'll discuss a little bit more with the Bezos Academy. Currently, we're under design phase and should go out to bid in early to mid-January for the construction of the United Learning Center. This is comprised of a roughly 12,500 square foot classroom for children ages 1 to 5. It'll accommodate about 80 kids. It'll be operated by the Bezos Academy with a Montessori themed early learning center. The museum will be attached to that. It's about a 5,000 square foot museum. And adjacent to the campus, there will be right next door a rec center and that will house the Boys and Girls Club and the gymnasium that the city is providing. So it'll be, the whole complex will be the United Learning Center. We've also began communications with Dr. Stride and Cascade to work on the full service wraparound services for these kids. And we're looking at the opportunity to possibly bring in a dental facility and possibly some mental health capabilities into the center. We've got a couple spaces that are available, and we'd love to have those partners in there and just make it even a stronger presence in our community. The city's been a great partner in this. They've donated the land, and we've received funds from the capital budget through appropriations for the Discovered Children's Museum, as well as for the Early Learning Center. We might be having an ask later for more money with COVID and some of the increases in costs and supply chains. The cost of construction is considerably greater than it was 2 years ago when we first started down this path. But we're just now completing the design phase. Luckily, earlier this year, through the relationship with ESD and Joe Clark, one of our committee members, we came in contact with Bezos Academy. One of the biggest concerns we've always had with the Early Learning Center is how we're going to pay for the operations. Luckily, Bezos Academy came in and will pay for the operations for 10 years. We do know that with the potential to extend 5 and 5, but that cleared a huge hurdle for us, and now we have a full-time operator to help with the need for early learning in our community. It'll be slightly different than what we see at Head Start and ECAP. The program will extend more to 200% of poverty, and so it'll be a much broader spectrum of people that are eligible. And I think it'll be a good complement to what we currently have in our community with Head Start and ECAP and the other facilities that provide early learning. There is a need. We are known as a early learning desert, and I'm glad we can provide this opportunity for our local youth. The need's greater now than it ever has been. So I want to thank you for your time, and I'm more than happy to entertain any questions. We are scheduled to open the Early Learning Center on September of 2023. Thank you. Thank you for your time.
Hi, my name is Jennifer Fadden, and I'm the Service Line Clinical Director for Valley View Health Center. I'm going to keep this pretty brief as we want to focus. We have two parts of our presentation, so I want to make sure we have enough time. Valley View Health Center is a federally qualified health center that was established in 2004, and we serve Thurston, Lewis, and Pacific counties. We're a fully integrated program with medical, dental, behavioral health, and pharmacy. We believe in treating the whole person while respecting individual and cultural diversity. A little bit about what integrated care is. Our behavioral health providers are on site. Obviously, since COVID, that's changed. We're currently still off-site doing telehealth, but we did have to shift pretty quickly so that we could still do warm connects with any clients that were in crisis for our medical providers and help support them. But by having our providers on site, that increases the access and breaks down barriers to mental health care for patients at our primary care offices. Our treatment is mainly provided for low, moderate mental health needs, and we coordinate any referrals if they're needing higher level of care or to specialty services. Our treatment is provided by a team that includes a medical provider, our behavioral health providers, and the UW psychiatric consultant. Each of our behavioral health providers consults with him on a weekly basis for about an hour. And this approach supports a rapid mental health diagnosis as well as a shared treatment approach. We do regular proactive screening and monitoring to assure that patients are treated to achieve their clinical goals. And now I'm going to hand over the presentation to Jose. He's been working really hard, especially during COVID, and he's going to be discussing collaboration with other agencies and providing outreach and COVID vaccinations for the Latinx community in Lewis County specifically.
Sorry, thank you for that. Thank you, Ian, and thank you everyone for who is in this panel today. I appreciate your time. My name is Jose Gerardo Pacheco. I'm a clinical social worker in Valley View. My role in Valley View is to provide behavioral health services for patients, as Jen just mentioned. Another part of my role in Valley View is the outreach and external collaboration with agencies in Lewis County. I've been currently joining with Equity Institute, Birdside Medical, and Public Health to engage the Latinx community to vaccinate against COVID. I usually join them in their clinics, which happened at the farms or their workplaces. It also happens in churches and other areas where they gather and stuff. Even though we target the Latinx community, everyone is welcome to receive the vaccine. At this point, we have reached several agricultural farms, Christmas tree farms, and reforestation workers. As we perform these clinics, we conduct research about vaccination hesitancy, and we also implement questionnaires to identify needs, which help us to then connect people to resources in the community. We at Valley View have put together also essential bags for people. They have some basic healthcare items and also health education, including information about how to access our services in Valley View. And we also include a list of resources, which is pretty much the organization, the information of the organizations participating in this meeting today. This year, we started planning community resources fairs, which include vaccination clinics. We had our first event this last July, and we're planning one more event for January 8th. We hope that we continue to make these bigger events where we can provide resources, information, and we can invite other organizations in the community to come and join us, delivering information and getting resources for people in our community. The upcoming event will include vaccination for adults and children. And we're going to also have educational materials, resources, toy drives. And I know that we have invited several of the organizations here today again. So I hope and this is going to be a great event, and more of those who are here can participate as well. As we continue to do this work during this pandemic, we seek to increase collaboration with different agencies. We want to ensure that people in need utilize the resources and available in their community. My hope is that we can create a net of organizations so we can collaborate and we can help people to direct them to appropriate services. Altogether, I think that we can, assist better the people in our community, and just make sure that they have better access to resources. Thank you.
Hi, my name is Angela Bennett. I am the CCBHC Expansion Grant Manager for Cascade Community Healthcare, and I also manage our new primary care clinic that we started last January. I also have notes that I will be referring to, so I don't forget anything important. So since the passage of the 2014 law creating the 2-year 8-state certified community behavioral health clinics Medicaid demonstration, Congress has extended the program numerous times, added new states to the demonstration, and enacted a supplementary grant fund available to demonstration sites and new CCBHCs throughout the U.S. Today, there are more than 430 CCBHCs in 42 states, but CCBHC expansion grants begin to expire in 2022, followed by the end of the demonstration program funding in 2023. Hundreds of CCBHCs will be losing their funding without immediate action. The Excellence in Mental Health and Addiction Treatment Act of 2021, bipartisan legislation to extend and expand the CCBHC Medicaid demonstration, was reintroduced in the 117th Congress in June 2021. The legislation will allow every state the option of joining the CCBHC Medicaid demonstration and authorize investments in the model for current and prospective CCBHCs. Each year since 2018, Congress has appropriated funds for the CCBHC expansion grants, a complement to the CCBHC Medicaid demonstration. Cascade Community Healthcare was a recipient of these expansion grant funds in 2020. We are asking for your support of the Excellence in Mental Health and Addiction Treatment Act of 2021. This legislation to expand the current CCBHC program so that every state has the option of joining the demonstration program and existing CCBHCs remain funded. In the meantime, states do not have to wait for Congress to extend the Medicaid demonstration opportunities to implement CCBHCs. They're available through existing Medicaid waiver and state plan amendment authorities. So in part, what does this grant do? The CCBHC grant allows for us to improve community-based, integrative, evidence-based, person-centered, and recovery-oriented care while being trauma-informed and culturally competent. This funding opportunity has opened up close partnerships with Hope Alliance, the Veterans Health Clinic, Valley View Health Center, CLO, the Youth Advocacy Center of Lewis County, just to name a few. I think currently we have over 30 community partners. We are able to support uninsured and underinsured individuals through funding provided by the grant. With the CCBHC funding, we can provide a more comprehensive range of care within our current outpatient behavioral health facility by opening our own primary care clinic. This primary care clinic works with our current clinicians and prescribers to support our behavioral health clients in achieving a high standard of physical health. Cascade uses our care coordination team members to assist clients with appointment scheduling, transportation needs, and provide access to community services within our service area. The care coordination team is active with all programs that can be serviced through this grant. Also, we have a care coordinator that's dedicated specifically to the referrals with Valley View Health Center for the higher level need clients that they refer over to us. And that care coordinator has access to scheduling in both our system and Valley View system so that those clients get truly integrated care between the two agencies. We've seen many improvements on the national outcome measures that are used to evaluate the CCBHC program. Some of these include a 13% increase in overall health, a 16.2% increase in improved functioning in everyday life, and a 13.4% decrease in serious psychological distress for clients that are participating in the CCBHC grant. CCBHC grant is a 2-year grant funded project here in Washington. Our state did not participate in the demonstration program, so the grant is limited to individual clinics rather than a comprehensive reform of behavioral health care as it was in the demonstration states. The objective is for us to be self-sufficient and continue to support current CCBHC only funded positions that typically do not generate revenue, while also permitting us to continue to serve uninsured and underinsured clients. What would make this sustainable is to see a payment method similar to what demonstration state clinics receive and similar to what federally qualified health centers receive. They bill per encounter versus a fee-for-service system like BHAs currently do in Washington. The prospective payment system has worked favorably for CCBHC clinics in the demonstration states and has allowed them to pivot services to meet community needs while also enabling them to retain high-quality staff. Alternately, we've heard that Washington may be contemplating moving towards value-based payment system, another alternative to fee-for-service that looks at outcome metrics and provider incentives. While encounter-based payments or value-based payment model, we can focus on, or with encounter-based payment models, we can focus on integration and quality of care, utilizing evidence-based practices. We'll be able to better provide care coordination, crucially focusing on whole person or integrated care, resulting in a higher standard of care that ultimately has been shown to improve long-term health outcomes, as well as reduce the overall cost of care, particularly for high utilizers. I want to conclude by saying that we are thankful for this opportunity to be the CCBHC expansion grant recipient and look forward to establishing sustainability after the grant project concludes in May of 2022. We're hopeful that another round of grant funding will become available to us and plan to use the second opportunity to continue to work towards self-sustainability with the structure of the CCBHC standards. We are excited and look forward to the possibilities CCBHC has provided for our clients and in the building of our community partnerships. If adopted, a model similar to prospective payment system method or value-based payment method will enable clinics across the state to raise the standard of care and will allow our state to be national leaders and innovators on the front of behavioral health care. I'd also like to add that we were able to increase our workforce by 33 positions, 2 of which are over at our SUD clinic. They're peer support positions, and although they don't generate a lot of billable income, the services that they provide to our clients and all of our care coordination services are invaluable and really can't put a price on them. They are able to facilitate needs for our clients that haven't been available before. Secondly, we were able to purchase a transport van and hire a transport driver to help our clients that are enrolled in our CCBHC grant get to appointments on a short notice if they don't have that 24-hour option or paratransit is unavailable. And lastly, with our primary care clinic, we were able to get our provider credentialed with veteran services. So she is available to see veterans now for primary care services, which, as Heidi mentioned earlier, with the closure of the VA clinic over at the mall in Lewis County is a huge benefit to that population.
Thank you, Angela. Here in just a couple of minutes, we're going to open it back up to our panelists if they have any questions. And I'm sure all of you are aware of the Surgeon General's report that came out on Tuesday, which warns of the youth mental health crises that's been going on. It's difficult to kind of quantitate what's happening there, but we've certainly seen an uptick in a request for services here, and some of the most concerning issues, I think, in that report is that emergency room visits for suicide attempts for adolescent girls were up 51% in 2021 as compared to the same period in 2019. That figure rose by 4% for boys, according to that report. So it just kind of underscores that because of COVID, there have been a number of things that have been going on in people's lives, and anxiety and depression in youth is particularly concerning. So if you haven't read that report, I'll certainly be happy to forward that to you. But that just kind of underscores what we've been saying throughout this entire forum, that mental health and behavioral health is so vital to overall health. And it's important that we look at ways where we can treat people and we can get them the services that they need. So with that, I'm going to go ahead and open it back up to all of our panel members. If you have questions for any of our presenters or comments in general, we would be happy to entertain those.
Richard, this is Mindy. Just on the heels of what you were saying too, I had just gotten a report from the CDC on how alcohol and drug use has skyrocketed during the pandemic. And I'm part of the AAP, which is the Association of Addiction Programs. And one of the things that we've been talking about in that program is there's a lot of calls going into crisis that are SUD calls, but they aren't being forwarded on to SUD for services or for treatment. So that was something that we really wanted to look at to see if there was a breakdown or a gap or what it looks like, what's going on there too. So I think that really ties in hand, because it did say that a lot of kids, the number for kids has risen with substance use also. Absolutely.
Again, it just emphasizes the need for behavioral health services. And I know House Bill 1310 was mentioned, and some other concerns with the mobile crisis team and law enforcement being able to work together because of the restraints of House Bill 1310. I've talked extensively about that in different venues, so I won't go into it here anymore. But it's important that we get some sort of legislative fix for that, because it does put our mobile crisis team in jeopardy, and it's certainly unfair to law enforcement. Do we have it back open to our panelists?
It should be open for anybody to ask. We're just waiting to unspotlight you.
Okay.
So it is open for anybody who wants to ask questions.
Do we have any questions from our panelists? Okay, doesn't sound like we have any at this point. So if you do have questions, certainly send those to us. We will be posting questions and answers on our Facebook page and also our 2 Facebook pages, and also our website. So if you have any questions on any of the presentations today, or questions for any of the presenters or for our distinguished panel members, please send those to us. I want to thank you for participating today. Thank you, panelists, for your time. I know that your time is precious, and we certainly appreciate you being here today. And presenters, you did a fabulous job. Thank you so much, and I hope you have a wonderful rest of the week.
Thank you.